My dear fellow Gibraltarians and residents of Gibraltar, it is 8 months since I last addressed you live from the seat of government here at 6 Common Place. Today I do so in order to explain the approach we're taking to the recent rise in cases of COVID-19 in Gibraltar and around us. I will also deal with the very fast increase in the new Omicron variant of COVID-19. Before I start to address these issues, I will start by sharing the latest data with you. I very much look forward to the day when we will no longer be providing such statistics, but for now, here we go. The total number of cases of COVID-19 in Gibraltar today is 488. However, of these, only 3 are in hospital. One case is a baby who has had COVID-19 detected on admission for another condition as part of the testing we do when patients are admitted. The child has therefore been admitted not as a result of a COVID infection. One case is in the COVID ward and is steadily improving. That person was vaccinated. One case is in the ICU, has been ventilated, has improved and is no longer ventilated. That person was unvaccinated. Since we started testing, we have carried out over 441,000 PCR tests. We have carried out 1,427 such tests overnight. Of the 488 live cases in question, 397 are residents, 78 are non-residents, and 13 are visitors. Of the 488 where we have variant data, 149 are Delta variant and 114 are Omicron variant, with the balance still being sequenced. Because of the 3-day lag in getting results of genomic sequencing, we believe that the Omicron variant will now have increased its prevalence in our community even further. It is therefore now very likely that the Omicron variant is the dominant variant in Gibraltar. With Omicron as the dominant variant in Gibraltar, it is important for us to address how to deal with its increased infectivity to ensure that the GHA is not overwhelmed by cases. Omicron is 70 times more infectious than Delta. The new evidence about the virulence of Omicron, however, is more positive. Omicron appears to be more infectious but less threatening to life. But we must still ensure that we keep all strains of the virus under control in Gibraltar. For that reason, the Cabinet decided on Monday that we should once again convene the top echelon of the Civil Contingency Command structure for the pandemic, COVID Platinum. COVID Platinum met this morning to assess the picture as we head into the Christmas holidays. The advice from the Director of Public Health, Dr. Helen Carter, is clear. Although we already have community transmission, the curve of infections is flat. We are already reaping the benefits and rewards of having maintained a very precautionary approach this autumn. I know many of you will be watching UK and international news channels, and you will be seeing nations around the world imposing conditions and rules and cancelling events and celebrations. You may ask yourselves why your government is not doing that here. The answer is that we in Gibraltar took those decisions and announced them some time ago. As far back as September and October, we took the decision to cancel our large-scale public events. We did that not because we knew that we were going to face Omicron, which only arose later. We did it because we were not confident we could safely go ahead with those events. We therefore proceeded with caution to avoid expense and last-minute cancellations. The same is true of mask wearing in shops on public transport. So the reason that you're not hearing us reimposing in the first place. The reason we're not cancelling events today is because this year we simply did not organize them in the first place. We recognize that the prudence we have called for has affected some businesses this year too, although certainly not like last year when we shut down our catering industry. This year, catering and hospitality may not be as busy as in other pre-pandemic years, but there is no shutdown, as in last year. As we did last year, however, we will work with the businesses that are having problems making ends meet these months to assist where possible. We will meet with the Federation of Small Businesses who have written to us to consider how to help. And we will meet in the new year with the Catering Association to properly calibrate how we can help in this new scenario in which businesses are open and operating, but the take-up is slower than in other years. But the reality is that the main reason we are seeing less hospitalizations in Gibraltar is plainly and simply our very high vaccination rates. We have administered over 41,000 first doses and over 40,000 second doses of the Pfizer vaccine. To date, we've already provided almost 27,000 third doses. We must continue to see the vaccines as the lifeline that the United Kingdom has provided and that has enabled us to start to navigate our way back to normality. In fact, it is incredible to think that it was just earlier this year that all our eyes were on the airport as we started to receive vaccines from the United Kingdom. We have never been closer to the United Kingdom or luckier to be part of the UK family of nations. We have really reaped the reward of our British status this year and during this pandemic. As an aside, let me say that you should therefore not let anything or anyone even suggest that any of us in government will be prepared to gamble with that uniquely and exclusively British status in the ongoing UK-EU negotiations. As a result of the vaccination programme, I fully expect we will now be able to enjoy Christmas with our loved ones without the need for further restrictions. Today, I'm therefore relieved to be able to tell you that I am announcing no further restrictions at all. There is today no requirement to restrict your civil liberties in order to protect life or the GHA's ability to protect life. Because we must neither fail to act nor overreact. We understand the impact that our decisions can have on other elements of life in Gibraltar. We understand the potential negative impacts of measures we might take to mitigate risks stemming from the pandemic. We understand that our decisions have an effect on our ability to get on with our lives and to get on with the diagnosis and treatment of other life-threatening conditions. But to keep it that way in the face of the Omicron variant, we do need to see continued and full take-up of our booster vaccines. As of today, with those almost 27,000 having had a booster jab, we have approximately 70% of those who've had the initial 2 doses now boosted. Of the resident population, 80% of our over 50-year-olds who had the second dose have now been boosted. This is very good, of course, but it is not excellent. It is not where we need to be. We have a way to go to ensure that everyone who had a second vaccine has a third booster. The GHA has pulled out all of the stops to get as many of you who wanted boosted before Christmas. I'm certain many of you will be taking your vaccine just as soon as you can. I'm certain we will continue to see a steady take-up in the new year when the program resumes. As we steer Gibraltar through what we hope, but cannot guarantee, will be a muted wave of hospitalizations, we're each making choices for ourselves that have consequences for ourselves and each of our fellow Gibraltarians. Because choices have consequences. Freedom of choice does not equal freedom from consequence. In the vaccine and in the help that we've had from the United Kingdom government in 2021, we are fortunate enough to have the choice that can keep us safe. We have the one weapon that works better than anything against COVID. We have a way out of this pandemic, which thousands of you have taken as part of the community-wide effort to get us out of this. I know that many of you will have taken the vaccine despite some reservations that you may have had. Despite those, you have balanced the needs of this community, your personal needs, and the needs of your family, and you've made the right choice. The consequence of this choice is that you join in with the community effort and we strengthen our hand against this threat when every one of us takes a moment to get boosted. Some have been advised by their doctors not to have the vaccine. There are many, however, who have chosen not to have the vaccine. There are many reasons why you may have chosen not to take the vaccine. Some sensible, others less so. There are those who, in addition to refusing to take a vaccine, are also taking a stand against doing literally anything whatsoever that is recommended or suggested, or in some instances, unfortunately, demanded or required for the protection of those around. The choice is yours, of course. The consequence of that choice, however, will also run to your account. Let me tell you that the two adults in hospital are of the same sex and of exactly the same age. Both are men. They are in exactly the same age, in their 70s. One is in the COVID ward and has only required some basic attention. He is vaccinated. The other patient, exactly the same age and the same sex, is in the ICU. He is not vaccinated by choice, not as a result of any medical advice. He has had to be intubated and ventilated, a highly invasive and dangerous procedure. Happily, he is today improving, and we hope he will live to tell the tale of his battle with COVID. But it is very, very, very likely that if he had been vaccinated, he would not have required intubation and ventilation. That would have saved our health professionals a huge amount of stress, time, and expense on his care. And so our booster vaccination program has been successful, but I have to emphasize that we have not yet had the same uptake of boosters as we did on the first and second doses. It is important to understand that because our vaccination program was so successful earlier this year, the effect of the double vaccine is waning, and it needs to be topped up with a third vaccine to boost our protection against the virus. It is very important that everyone has the COVID vaccine booster shot. Vaccines are humanity's shields against infection. By having them, we act in community and we show that we care for each other. By having them, we protect ourselves and we protect each other. I would ask that those who haven't yet had the booster should therefore please make arrangements to do so as soon as possible. The vaccine will keep you safe. More importantly, it will also keep others safe. The higher the number of people in our community and our cross-frontier population who are vaccinated, the safer it makes it for all of us as a nation. Remember that as with all vaccination programs, taking a vaccine is an altruistic gesture. Our next vaccination clinic is on the 29th of December, and this is by appointment. The clinic after that will be dependent on the further numbers who have registered. Online registration is available at gha.gi/Pfizer booster, and you will be called by the GHA with the details of your appointments. We have to be mindful that the GHA colleagues who are and everyone in the GHA who is supporting the vaccine program has been working flat out to keep you safe throughout this year. The booster vaccination clinic has been largely undertaken after hours so as to minimize the impact on ordinary services. We made the clinic available full-time for a couple of weeks to be able to meet with the demand of the booster ahead of the Christmas break. This means that those who have brought this service to you have been there for you to give you the booster injection after a full day's work, and they also need time off during this period. We're nonetheless conscious that our students will be returning to the UK soon, and so of course we want to ensure that they are boosted. So we've made special arrangements for them to ensure that they are given an appointment for their booster jabs as soon as possible. Any student who has not yet registered for the vaccination should do so via the link, which is gha.gi/booster-registration-for-university-students/, which I'll post on my social media feed. As a final point on vaccinations, if you have to decide what to do because you're unsure, don't just listen to me. Don't take legal advice from a scientist, and don't take scientific advice from a lawyer. Ask your doctor. Don't ask Facebook, Google, or YouTube. Please do not take your advice from the internet or social media, where the person giving you advice may not be qualified and may not even be the person that they say they are. More and more countries are now introducing the need to have a COVID digital pass to gain access to venues including bars and restaurants. I can report that we launched our COVID Pass on the 8th November, having worked on this with the NHSX since the 1st of July. It is totally EU compatible and works perfectly. However, we were removed from the EU Digital COVID Pass network by the UK when it became apparent that the EU had not been informed that Gibraltar was included with the United Kingdom's NHS COVID Pass. As I've previously said, I've raised this issue with the Foreign Secretary, and we're seeking to expedite administrative approval with the European Commission at the earliest opportunity. In the interim, the GHA's COVID Pass has been modified to enable users to download the PDF certificate if they wish to print them out, or to request a certificate on the official GHA HMGOG letterhead, which will be emailed to you. Given increased demand and the upcoming Christmas holiday, this is expected to take at least 7 working days. For all those of you who have now had the booster, I'm pleased to tell you that these certificates are being updated to include the details of your booster by no later than 24 hours after you've had that vaccination. I will report to you further as soon as we have resolved the administrative issues with the European Commission. All of that, of course, is about convenience to travel and access to leisure. But in the end, we must not forget that 2021 has been a year when we have lost 93 Gibraltarians to COVID. 7 more were lost in 2020. The COVID inquiry will begin as soon as possible in the new year to enable us to learn the lessons of this pandemic and how to avoid such level of casualties in the future. So as we head into the Christmas period, I ask you to spare a thought or a prayer for each of those we have already lost and for their friends and families as they face this season without their loved ones. I have written to the next of kin of all of those who have succumbed to COVID. Today, I've also written to all public servants, thanking them for their efforts this year and last. It has been as difficult for the public sector in 2021 as it was in 2020. I've extended my gratitude to all who have provided public services throughout. I've singled out those in health and care in particular, but all our public servants deserve recognition for the work done in this period. I also want to acknowledge, of course, that through our concentration on COVID, and in my case also the Brexit negotiations, we will have failed to deal with some matters. I trust that as we get through 2022, we will be able to turn our attention again to many matters we have been unable to address during the pandemic. This is particularly true also of the GHA, which has borne the brunt of the trauma of COVID, and I'm very pleased that Samantha Sacramento has shown the courage of leading a Restart and Recover program in our health services. As a result, as we announced last month, from the 10th of January, the GHA will be run by a new Director General answerable to a new GHA board. All of this in particular, all employment matters and industrial relations for the health services, will be run by the Director General and not by any politicians. So as we turn our attention to the next few days, please remember the message every year from the RGP when they implore us not to drink and drive. Every year, some people ignore this advice, and so they put their own lives and the lives of all other Gibraltarians at risk. This week already, 5 people have been arrested for drink driving offences, and all of these drivers were way over the limit. This year, our free bus service is operating on every day of the holiday period, and taxis are also available. Quite simply, there is no excuse for anyone to drive home after they've had a few drinks. Nothing would give me greater pleasure than to be told on the 4th of January that there were no drink driving arrests over the holiday period. Alcohol also has a role to play in many of the cases of domestic abuse that are reported to the RGP, and we cannot pretend that domestic abuse is a problem not arising here in Gibraltar. To anyone who suffers in this way, I would say call the RGP. They have experts who are available 24/7 to provide you with the support that you need. And if you see abuse taking place at a neighbor's house or with your relatives, I would implore you to let the RGP know about it. Better to be safe than sorry. The RGP also continues to play a part in our efforts to minimize the spread of the latest COVID variants. In particular, they're working hard to ensure that everyone who arrives by air is tested immediately after their arrival, and that people who have tested positive are indeed self-isolating rather than spreading their infection amongst their friends and family. Only yesterday, 2 people were issued with £300 fixed penalty notices for being in breach of the government's COVID-19 testing regulations. A local woman was also reported after she'd been seen irresponsibly socializing despite knowing full well that she had tested positive for COVID-19. We do not need such irresponsibility, making it harder for the rest of us in the community. Please remember that whether they are responding to road traffic incidents, cases of domestic abuse, or of people breaking the COVID regulations, RGP officers are out there keeping our community safe 24 hours a day, 365 days a year. I thank them on behalf of all of us, as I do all our law enforcement, essential and emergency services, for their continued service this festive season as the rest of us enjoy time away from our places of work. Christmas is also a stressful time for some. It can be overwhelming, and I remind everyone that the GHA's mental health crisis line, 111, is available 24/7 over the Christmas period. If you find yourself or a loved one in a mental health crisis, do not hesitate to call 111. Leading Gibraltar through these past 22 months has been the hardest thing I will ever do in public life. The past 22 months have been the hardest in the modern political history of Gibraltar and our people. For the whole cabinet, the Deputy Chief Minister, and for me, leading Gibraltar through these difficulties has never been a burden. It has always been a pride. Thank you for your fulsome, continued support and confidence throughout this period. There are challenges to come, but none like this, with such great risk to so many of our precious people's lives. We look forward to a better year next year, to a more positive balance sheet in every respect. For now, before I take questions from the journalists assembled here, I want to wish all of my fellow Gibraltarians a Merry Christmas and a Happy New Year. If you're going away, as I hope to do with my family for a few days, please familiarize yourself with the rules in whatever destination you're headed for. Please enjoy the festivities with family and friends in a prudent and sensible way. Merry Christmas, Gibraltar, and a happy and healthy start to the new year.
Chief Minister, 2 questions for you on what you've just said. You said that you're not envisaging any new restrictions at this point, but obviously with the rising number of Omicron cases, that may change. What are the trigger points that you're looking for?
So we're going to be looking essentially at the numbers of infections, the numbers of hospitalizations, and the mortality rate. That is obviously going to be key. The Delta variant is still amongst us. We've seen how Alpha, Delta, and Omicron have made their way through Gibraltar's community. Those who have had Delta may also catch Omicron, so the infectivity level is going to be important. The virulence is particularly relevant because if Omicron is milder, then we won't see those larger numbers of infections manifesting in the need for care by the GHA. That is going to be fundamental. Remember that the reasons that we have acted have always been on the basis of the need to protect life. That's the only reason, on the basis of our written constitution, that we have the right to restrict civil liberties. We can only act to protect life, in particular if the GHA is being overwhelmed, and we need to act to protect the GHA's ability to protect life. Those, therefore, are the key factors in play. What are the numbers of infections? What are the likelihood that those numbers of infections will require care from the health authorities? And what are the numbers of deaths?
How do you deal, for example, with GHA workers, ERS workers who are either absent because of sickness or absent because they have to self-isolate because they've been in contact with someone who's developed COVID? What's in place to deal with those demands on those vital human resources without which the GHA doesn't function?
Well, those are exactly the issues that you have to keep an eye on, whether the level of infectivity is affecting not just the numbers that require the care of the GHA, but the GHA's ability to provide that care, not only because it's flooded by people who require the attention of the GHA, but because the GHA's own staff fall, all at the same time are unable to provide that care.
How do you deal with that if that happens?
So in exactly the same way as we dealt with it last time, when the time comes, if it becomes necessary, we will start to operate different teams to try and create bubbles so that if one team goes down, another team will be available. We're not yet at the tipping point when that is required. We're also changing the isolation requirements, and we're changing the requirements as to testing so that people can continue to operate in a particular field by testing themselves and making sure that they are not, even though a PCR test might say they are positive, if a lateral flow test says they are not, then they're not infectious and they can go to work.
And is there a hospitalization figure that would trigger, is there a number?
There isn't a number. This is something which is in constant review, and the numbers would depend, for example, on our ability, because of the staff that we have, to deal with the flow of people into the GHA, the numbers of beds available in the GHA. All of those factors come together and give you a different number on each day. So I can't tell you that the number of infections is, if it's 488 today, 750, and that's going to trigger the need to take steps. That's not how it works. It's not something which is that objective. It requires more day-to-day calculation.
Okay. And with the indulgence, if just the second question that I wanted to ask, you mentioned that people who choose, for whatever reason, not to have a vaccine, that choice has consequences. You've spoken about the people in the hospital, the gentleman in the ICU. There's an obvious consequence there. But did I detect in what you said that there may be other types of consequences for people who choose not to have the vaccine going forward? For example, in Spain, you need a vaccine certificate, a vaccine passport to access hospitality venues now. Are you envisaging any restrictions of that nature?
It's not impossible, but it's coming potentially in
Sorry,
different countries. It's not impossible, but it's coming in different countries already. Depending on how the pandemic plays out, these things may continue to be relevant through the winter period, and they may have to be implemented in Gibraltar. For example, if you say to the people of Gibraltar, look, the choice is simply to shut all catering again, or to require people who go to catering establishments to show that they are vaccinated, and to require those who work in catering establishments to show that they are vaccinated, so that you create in each catering establishment a bubble of the vaccinated, which is safer than having the presence of the unvaccinated in those circumstances. I think people would say, well, look, in those circumstances, you should have those controls for access to those areas. I've used catering as an example. You could use the theatre as an example. You could use any area where people are going to be in an enclosed space as an example of an area where you might have to restrict access to those who are simply vaccinated. At the same time as you don't make vaccination compulsory, and you provide other ways for people to access those bubbles. For example, you might say you can access the bubble if you are unvaccinated in a restaurant by showing that you have a negative lateral flow test within the past hour and a half, or by demonstrating that you haven't taken your vaccine because you are told by a doctor that you have underlying conditions which make you a person who's at risk from vaccination. But in those circumstances, it is not impossible to see that it makes sense, whilst you're not requiring people by compulsion to have vaccines. I think that is something which is anathema to our system of laws, to control where those who are unvaccinated have access. And this is why the decision not to have a vaccine may have a consequence already outside of Gibraltar, and it may have a consequence in Gibraltar for the person's ability to access different places, which is not to affect their personal liberty, it's simply to seek to protect the largest number of people.
But are you actively looking at it?
We are actively looking at it, and we will continue to look at it, because as we go into the winter, we cannot find ourselves in a position where we are surprised by the fact that the infection is spreading because a small number of unvaccinated people are coming into areas where the majority are vaccinated, but they're in such close quarters with the unvaccinated that this becomes necessary. I'm not telling you that we're going to do it, but we would be remiss not to be looking at these things which are already in place in the rest of the nations of the European Union.
I wanted to ask you about lateral flow tests, given that they're available in other countries, and in some countries like the UK, they are actually free. over the counter in pharmacies, and the health minister himself has emphasized the flow before you go policy, that is to say, take lateral flow tests before you go to families' homes this year for Christmas, etc. Why are they not available here in Gibraltar, especially given that during the Christmas period, the testing facilities themselves are even closed?
We're looking at how to make those tests available in Gibraltar in a way that is safe. There are many tests out there which are dodgy, let me just put it that way in the vernacular, and we don't want to open the floodgates to people having lateral flow tests in good faith, which are giving them the wrong result and therefore creating a false sense of security. So I expect that we'll be making an announcement in respect of lateral flow tests being available in Gibraltar as we go into the winter.
But could you not have looked at this ahead of the Christmas season, given that testing centres are closed, and it would have perhaps
Yes, we could have done all of that, and then we wouldn't have been able to do the other things that we've done. What we've done is ensure that we've worked on the booster program, which is the best way to deal with this. So it's better to be boosted than to do a lateral flow test telling you whether you're negative or you're positive. Because if you're boosted, you're very likely to be negative. Remember that the evidence suggests that with the third Pfizer booster, you're 70% likely not to get even the Omicron variant. So we had to make a choice about what we did. We are a small administration, tested to the limits over and over again for the past 22 months. So we could have done that, but then we wouldn't have been able to do what we've done. And what we've done is the best possible thing for every Gibraltarian, which is to push the vaccination program.
Okay, in the UK, they've changed the advice on the isolation period from 10 days to 7 days based on public health assessments. Is that something that we're looking at here as well?
Yes, we are.
Just to go back on this issue of the lateral flow test, because I echo what he's saying. It seems to me like, as well as the booster, an extra safety net. And even if there are dodgy tests in the market, there are also tests that aren't dodgy, which people can buy in pharmacies in Spain and are given for free on the NHS in the UK. So why is it that we don't have it?
Because you have to put in place the infrastructure to ensure that the tests that come into Gibraltar are the tests which are not the dodgy tests. Because you're absolutely right, there are many tests which are not dodgy, but there are many tests which are. And you have to ensure that the ones that come into Gibraltar are the non-dodgy ones. And therefore, ensuring that that mechanism can be in place in the time available has not been possible, but it is something that we are seeking to ensure that we can do as soon as possible as we come into the critical period, which is the winter. Remember that the critical period is not just the holiday season, it's the whole of the winter period. This is the beginning of what you might call the critical period because of the Christmas festivities, etc., but not the whole of the critical period. We're going to go into the winter, which is the period in which we need to ensure that people remain safe, and the best way for people to remain safe is not to have lateral flow tests that tell them that they're negative so they can go out and socialize. The best way for people to remain safe is to have their booster vaccines. That is unequivocally, clearly, scientifically correct.
On that issue, and going back to the original question about the unvaccinated, is the government doing enough to engage with people who are reluctant to take the vaccine, often for very legitimate concerns? They may be worried about the health impacts, they may be worried about the fact that it's a relatively new vaccine. Is enough being done to engage with these people, to listen to their concerns, and to have a conversation with them that may change their minds?
Well, I'd like to think so. It's not something for the government to do as a political entity. It's for people to do with their physician. If you have an issue with a vaccine, don't come and talk to a politician about it. I mean, I've been very clear. There is one scientist in my government. He's the Minister for Public Health, but he is not qualified to advise in respect of this vaccine. The only people who are qualified to advise in respect of this vaccine are your doctors. So if you have a concern about your vaccine, go and have a conversation with your doctor. Don't ask to talk to a politician about it. The politician can only tell you what we are being advised by those who are experts in public health, by those who are experts in medicine. This is not a social conversation that we need to have about vaccines. This is a personal conversation that you need to have with your doctor about your views about the vaccine, and take your doctor's scientific and medical advice. But as we know, what is happening is that there are social media movements trying to get people to join into a movement which is against vaccines, not just against the vaccines that we're dealing with now. There have been anti-vaccine movements in relation to other vaccines going back some time. And my concern is that we understand that the preponderance of scientific reputable advice tells us that the vaccines are the way out of this pandemic. If you look at Gibraltar in the past 9 or 10 months since we've had the vaccine available, there have been no deaths attributable to a vaccine, as might be suggested by less reputable elements on the internet. There has been a very clear period in which we have been able to fight back against this infection because of the vaccines, and it's also clear that in relation to new strains, if you've had the third COVID booster from Pfizer, then you're better able to withstand the Omicron variant, and the Omicron variant, which is already less virulent, is going to be even less virulent in you. There was a recent statement by the Center for Disease Control in the United States, which pointed to Gibraltar as being a high-risk jurisdiction because of the numbers of infections in the jurisdiction, that also provided the statistics of what the resistance that the human body has when boosted against the serious illness or death on the Omicron variant and COVID generally, and it brought it down by factors of hundreds to 0.01% chance of death. So look, that conversation which needs to be had by an individual who is concerned about the vaccine, or for all of the reasons that you've legitimately pointed to, is not a conversation to be had by me. I'm neither a doctor nor a scientist, neither are the rest of the politicians in my cabinet, neither are members of the government who might be in the wider administration. It's a conversation to have with a doctor.
Concerns about the levels of social interactions that we're seeing in bars and restaurants in the few days ahead of Christmas, given the rising presence of the Omicron variant in Gibraltar?
So, the concerns that I need to have must come from the other end of the spectrum. In other words, we must look at whether that is going to create a situation where, if there is infectivity in any of those groups, the GHA is going to find itself overwhelmed by the numbers of infections and the numbers of people requiring care or hospitalization as a result of infection. If there is no need for the GHA to intervene in those cases, and the way that the curve is developing, which is relatively flat at the moment, it does not appear that the increased number of cases is going to require hospitalization because of the numbers of people who have had their vaccines, then the government has no levers to enable it to interfere with that level of social interaction that there's been, other than to call for prudence, as we have done, a call for prudence which appears to have been so successful that catering establishments are telling us that although we have not by law required them not to operate, it has had an effect on how people are socializing in those establishments. So it would seem that that virtuous circle is working in the right way.
You mentioned the inquiry into the pandemic and the handling of the pandemic. Unless I misheard what you said it would be sometime in the new year. Mm-hmm. Can you tell us a bit more about when you expect that to be underway, who's going to oversee it, what shape it will take, just as much detail as you can give us?
Not at this stage, because a lot of work has been done on that, and I have a fairly good idea of how to answer your question, but we haven't yet made the decisions, and therefore I want to leave open the possibility that the Cabinet may make different decisions when the time comes to press the button to start the inquiry. The time will be, if we are in the new year and we do not have a GHA that is suffering greatly as a result of the curve, to start as soon as possible in the new year. What we can't do is start the inquiry if the GHA is suffering, because we find ourselves once again having to deal with a large number of hospitalizations, which we certainly hope will not be the case, and we hope that the measures that we've taken to date will continue to enable us to see a flat curve and certainly low numbers of hospitalizations and no deaths.
But can you tell us who would run it, for example? Who would?
No, I can't tell you now, because although I have a very good idea, we haven't yet finalized those issues, and I don't want to say something which then becomes a hostage to fortune if we cannot finalize it.
I have one last question for you. We're seeing changes in the Spanish restrictions, mask use outside, that kind of thing. Are you I mean, I know that you're in regular contact with the Spanish authorities, but are you discussing what impact a surge here or there might have on critical issues, border flow being at the top of them?
Well, those are the issues that we keep constantly under review. I mean, remember that Spain is bringing the masking in public places back because it had undone it in open public spaces, and in particular, given the take-up of the vaccine that they have been able to deliver. And Spain is amongst one of the nations in the European Union which is most advanced, but we are much more advanced than Spain and most other nations in the European Union. So you find that in Spain, I believe the target set by President Sanchez is that 80% of the over 60-year-olds should be vaccinated by the end of December, and 80% of the over 50-year-olds should be vaccinated with a booster by the end of January. I've told you already that we've already hit 80% of the over 50-year-olds who had their second jab having their third jab already. So we're way ahead of that, and it's for that reason that we're maintaining our posture on masking in enclosed places like retail and like public transport, but not requiring masking in open public places.
And if I may, just because you mentioned the Brexit issue, when are you back with when are the negotiating teams back after the new year? Is there a date now?
There is a date, but I expect that we will all agree to make an announcement as to that date, and that we will make it. We want to make it together. There are already dates for 2 rounds and for other ancillary work that needs to be done, which I think is a demonstration on the part of all of the entities that are involved in this process to have an eye to how we're going to retake the process, and the work that we need to do between now and then in each of the relevant delegations is work that is ongoing every day to ensure that by the time we hit that date, we are ready to progress matters. Okay. So all that is left for me is to thank you all for having joined us this afternoon at number 6 Commonplace. Please be careful and prudent as you enjoy the Christmas festivities. Have a great start to the new year, or buen principio, as we say in Spanish. And I hope to address you again on the 10th of January, my New Year's message, as we then will look forward to 2022 and the year to come. Thank you for joining us at number 6 Commonplace.